Generalized Anxiety Disorder by Karen Vetsch. According to Durand and Barlow, generalized anxiety disorder, also known as GAD, is an anxiety disorder characterized by intense, uncontrollable, unfocused, chronic, and continuous worry that is distressing and unproductive, accompanied by physical symptoms such as tension, irritability, and restlessness. Adults typically focus on possible misfortune to their children, family health, job responsibilities, and more minor things such as household chores or being on time for appointments. Children with GAD most often worry about confidence in academic, athletic, or social performance, as well as family issues. Possible causes of this disorder may include a biological vulnerability, genetic contributions towards anxiety and a tendency to be tense, generalized psychological vulnerability. They develop a sense early on that important events in their lives may be uncontrollable and potentially dangerous, a heightened sensitivity to threat, a threat to personal relevance, and autonomic restrictors, failure to process emotional component of thoughts and images. People with GAD show less responsiveness on physiological measures such as heart rate, blood pressure, and respiration. There are physical symptoms such as muscle tension, mental agitation, susceptibility to fatigue, some irritability, and difficulty sleeping. Drug therapy, along with psychological treatment, are reasonably effective. A few of the medications prescribed are benzodiazepines, paroxetine, and venlafaxine. A few of the psychological treatments available are cognitive behavioral treatment, meditational therapy, and mindfulness therapy. The following are some of the medications and their common brand names. Benzos affect a key neurotransmitter in the brain called gamma aminobutyric acid, GABA. This neurotransmitter has an inhibitory effect on motor neurons, thus the presence of GABA slows or stops neuronal activity. It enhances the activity of GABA, effectively slowing nerve impulses throughout the body. The human nervous system has two different types of benzoreceptors, one that causes the anti-anxiety effect and one that elicits the sedative effect. Benzos are frequently used for short-term management for anxiety. This drug promotes relaxation and reduces muscular tension and other physical symptoms of anxiety. They can be habit-forming and can cause a number of side effects, including drowsiness, reduced muscle coordination, and problems with balance and memory. Paroxetine is an antidepressant in a group of drugs called selective serotonin reuptake inhibitors, also known as SSRIs. It affects chemicals in the brain that may be unbalanced with people with depression, anxiety, or other mood disorders. Paroxetine increases the amount of serotonin, a natural substance in the brain that helps maintain mental balance. The most common side effects are nervousness, restlessness, drowsiness, dizziness, nasal irritation, insomnia, nausea, constipation, weight changes, decreased sex drive, impotence, yawning, dry mouth, or ringing in the ears. Venlafaxine is in a class of medications called selective serotonin and norepinephrine reuptake inhibitors, SNRIs. It works by increasing the amount of serotonin and norepinephrine, natural substances in the brain that help maintain mental balance. Side effects include nausea, drowsiness, dizziness, dry mouth, constipation, loss of appetite, blurred vision, nervousness, trouble sleeping, unusual sweating and yawning. Psychological treatments available are CBT, meditational therapy, and mindfulness-based therapy. CBT involves patients evoke the worry process during therapy sessions and confront anxiety-provoking images and thoughts head-on. The patients learn to use cognitive therapy and other coping techniques to counteract and control the worry process. Meditational therapy focuses on acceptance rather than avoidance of distressing thoughts and feelings in addition to cognitive therapy. Meditational approaches help teach the patient to be more tolerant of these feelings. Mindfulness-based therapy combines the ideas of cognitive therapy with meditative practices and attitudes based on the cultivation of mindfulness. Subjects become acquainted with the molds of mind that often characterize mood disorders while simultaneously learning to develop a new relationship to them. Psychological treatments are used either with or without medication. The DSM-5 Disorder Criteria Summary includes the following. 1. Excessive anxiety and worry occurring more days than not for at least 6 months about a number of events or activities. 2. The individual finds it difficult to control the worry. 3. The anxiety and worry are associated with at least 3 or more of the following symptoms: restlessness or feeling keyed up or on the edge, being easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, and or sleep disturbance. Number 4, the anxiety, worry, or other physical symptoms cause clinically significant distress or impairment in school, occupation, or other important areas of functioning. And number 5, the disturbance is not due to the direct psychological effects of a substance or a general medical condition that is not better explained by any other mental disorder. Community resources for GAD in Monticello and surrounding areas include Healing Moments, Central Minnesota Mental Health Care Center, Tollefson Counseling Services, Theraspire Counseling. Shane Trechichad is a licensed professional counselor at Healing Moments and has a particular interest in assisting clients who are dealing with anxiety and GAD. Central Minnesota Mental Health Care Center has 5 mental health care professionals that specialize in this area: Danielle Brandt, Marie Fisher, Kelly Lindberg, Laura Smith, and David Earl Johnson. Tollefson Counseling Services is owned and operated by Barbara Tollefson. She specializes in this area as well. Theraspire offers help for anxiety and GAD through hypnotherapy. The Family Counseling Center in Buffalo has 6 therapists who specialize in this area: Mary Marty, Jay Wistrom, Stacy Van Cura, Michelle Beeman, David Schmidt, and Stacy Wakefield. The American Counseling Association is a nonprofit, professional, and educational organization that is dedicated to the growth and enhancement of the counseling profession. Founded in 1952, ACA is the world's largest association exclusively representing professional counselors in various practice settings with 56,000 members. The mission of the American Counseling Association is to enhance the quality of life in society by promoting the development of professional counselors, advancing the counseling profession, and using the profession and practice of counseling to promote respect for human dignity and diversity. The ACA informs patients' rights through a code of ethics: the right to privacy, consent, informed consent, right to treatment, advanced medical directives, right to die, privacy and confidentiality, and Federal Patients' Bill of Rights. Patients' Bill of Rights is a list of guarantee for those receiving medical care. It may take the form of a law or a non-binding declaration. Typically, a patient's Bill of Rights guarantees patients information, fair treatment, and autonomy over medical decisions, among other rights. Patients' Bill of Rights receive full disclosure of their insurance plan described in this list.